Kidney cancer is a cancer of the kidneys, which can be either the cancer of the solid part of the kidney or sometimes in the cavity of the kidney, that is the urinary collection system. And it is basically a unbridled multiplication of the cells, which is cancer, like in any other cancer.
Most often, kidney cancer has got no signs and symptoms because it is detected incidentally when ultrasound is done for evaluating pain abdomen, fever or any unrelated symptoms. So, on ultrasound, there is a growth which is picked up on the kidney. When there is a large growth, very large growth, that time there is pain, there can be locally a swelling, a lump felt in the abdomen, and there is anemia or passage of urine, blood in the urine. So, if patient has got these symptoms, this is already indicative of a very advanced disease.
The exact cause of kidney cancer, like any other cancer, is not known. However, there can be certain predisposing factors like smoking, obesity, blood pressure, chronic kidney disease, prolonged dialysis, and rarely some parasitic infections and even stone disease can lead to kidney cancers.
The diagnosis of kidney cancer today is dependent on the findings which we see on ultrasound and on CT scan of the abdomen. Here we find the size, the location of the tumor, we find how are the blood vessels and where all the cancer has spread.
The kidney tumors can be involving a very small part of the kidney itself. Subsequently, they may enlarge to a larger size where they can pass out beyond the capsule of the kidney and beyond even the fat layer that covers the kidneys. Sometimes the kidney cancer can grow into the veins that are taking the blood from the kidney into the system in the body, and this growth of the tumor, called as tumor thrombus, can finally grow into the renal vein and even as far as the main vein of the body, that is the inferior vena cava, and sometimes it can reach into the right side of the heart.
So today we have many treatment options for those tumors which are small. If they are small, which means that usually they are less than about 7 or 8 centimeters and they are not very close to the blood vessels, they can be removed by what is called partial nephrectomy, which means we remove the tumor and save the rest of the kidney. This operation of partial nephrectomy we do most often by robotic surgery on the Huber robot platform which we have got. We can also do this operation by laparoscopy, or those patients who are still not comfortable with these minimally invasive surgeries, and in sometimes when the kidney is in a critical position, like there is only one kidney, that time we will do this operation by the old open technique also.
The kidney cancer is definitely curable when it is treated and found out in the early stages of its existence, namely if it is limited to the kidney. If it has involved the lymph nodes or it has gone beyond the limits of the kidney, beyond the fat layer that covers the kidney, then it may be advanced. However, a treatment is always possible and depends on the surgery. After the surgery, if the margins are negative, if the lymph nodes are not involved, if the disease has not reached into the adjacent organs, then it is definitely curable and treatable. However, if that is not the case, and rarely there can be microscopic metastasis or the disease cells going elsewhere in the body, and there can be a recurrence.
So the side effects from the treatment are negligible because we are doing these operations with the minimally invasive techniques by laparoscopy or by robotic. There is very little pain. Usually it lasts for only 1 or 2 days and then patient is able to walk around. So the other things that patient needs to remember is that these treatments are for long time. So surgery is the first stage of the treatment. After that, he has to be on follow-up. We do CT scan, chest X-ray, blood and urine tests, and if there is any signs that the cancer is coming up, then we give additional treatment for that.
The predominant treatment of kidney cancer is the surgery itself. However, in certain cases and certain types of kidney cancers, we may need drugs in the form of targeted therapies and some immunotherapies.
So this is actually a talk about the cancer of the kidney. So in that regard, if a patient has got a previous history of kidney cancer, or the patient has got a history of bleeding earlier which has not been evaluated, he should be seen by a urologist or a uro-oncologist. We will do the blood urine test, we will do a CT scan to see if there is actually any growth there. Other than that, we advise patients who have got a family history that they should be careful not to use excess of drugs like Voveran, Brufen, Combiflam, these kind of drugs which are used in chronic joint pains, body ache, etc. You should limit their use to the extent possible.